Title of the talk, Vitamin C 24/7, Optimizing the Impact of a Universal Therapy. I want to briefly show you where I'm going with this presentation so you can get an idea of why I'm attacking and addressing different pieces of information. First of all, I feel it's essential to go through these concepts. Although I'm sure many of you have heard me talk about them before, I like to set the foundation in each presentation as to why what I call key information is so important. And like anything else, significant concepts are foundational. You got to build the foundation, and then you can appreciate the nuances of something else. So we're going to look at redox physiology, the primary sources of oxidative stress, a quick overview of what vitamin C has already been established to do, some of the new things that are now emerging in vitamin C therapy, particularly sepsis, which is especially significant because it's shining a light on the importance of different ways to apply vitamin C in an even more effective fashion, at lower doses, at lower costs, with less staff needing to be involved. And then right here, the address of possibly resolving what I consider to be the most disease-causing and disease-promoting condition in the history of medicine to date, which is the supposed loss of the ability of the human body to make vitamin C like the rest of the animals in the wild, except for the guinea pig, the fruit bat, and the primates. We're number 4 that supposedly are shackled with this inability. And then finally, an updated multi-C protocol. Oops, it's sensitive. So as with all my presentations, you see a lot of numbers. Take that number, go to PubMed. You'll see either you'll see the abstract for sure, and oftentimes the whole article. So, conceptually, and I have been actively looking for an exception to this for over 10 years now. And I don't think there's an exception. And as I said, if there is, I haven't found it. And that is, although disease and the human body and all the factors that come into play in disease is very complex, all the enzymes, all the pathways, blah, 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 I'm going to tell you that the final common denominator of what causes disease could not be simpler, could not be more elegant, could not be less complicated. And that is, all disease is increased oxidative stress. All disease is when biomolecules, nucleic acids, proteins, carbohydrates, enzymes, DNA, RNA, when any of those biomolecules become oxidized, they lose an electron or more than one electron, they become either impaired or completely inactive. Well, what's more significant as a disease process than a biomolecule that can no longer work? That's disease. Okay. Then the degree to which the number of biomolecules, the location of the biomolecules, et cetera, is oxidized determines the unique disease process. We often hear, or are increasingly hearing, that oxidative stress causes disease. I want to refine that a little bit and make it even simpler and more elegant, which is increased oxidative stress is disease. And the degree to which you can prevent new oxidative stress from developing, new toxins, and the degree to which you can repair or reduce and donate electrons back to other oxidized biomolecules is the entire goal and determines whether you stabilize, improve, or resolve a condition. And the only conditions that aren't really completely resolvable are the ones that have had 10, 15, 20 years of more and more and more and more biomolecules getting oxidized. The layers go deeper and deeper and deeper, and it's just simply no longer resolvable because you have secondary mechanical and structural damage. But for the principles I'm talking about, I will go out and tell you something radical, which is all disease processes, at least early on to mid-range in length, are reversible. As Dr. Huggins told me many years ago, in his rather dry, sardonic fashion, I'm asking something and he's getting frustrated with me. And he looks at me, he says, "Tom, you can't dry off while you're still in the shower." So I think you got something there, Hal. And it's true. Modern medicine, quote unquote, makes no attempt to stop the input of new toxins and does nothing at all to repair the damage of old toxins. Quite the opposite, they use toxic medications to interrupt pathways to artificially reduce the symptom while letting the oxidative damage go on. But biological or alternative or complementary medicine typically only goes half the way. We're starting to do it all the way, but half the way is when you start effectively reducing oxidized biomolecules, you'll get a positive response. But how positive it is depends on whether or not you've still addressed the shower being on. You need to turn it off and then address repair. And of course, this group is very familiar with the contribution, that's an understatement, of the infections in the oral cavity to oxidative stress. And let me say this, there's still a lot of complementary books of hidden epidemic for anybody that doesn't have one, and also have no desire to take them home, so feel free to get a couple if there's any left for your office staff and the waiting room, etc. I mean, there's nothing more ridiculous, in my opinion, than a book unread. Okay, so I've got no desire to stockpile books that are just paperweights. Okay, and this, to make it clear, because it's a very important concept. A toxin is a pro-oxidant is a toxin. They're synonyms. There might be a rare toxin that doesn't directly oxidize. It might cause something to be oxidized. But the bottom line is, all toxic damage is oxidation. That's it. All toxic damage is oxidation. Conversely, antioxidant, vitamin C is the prototype, that brings electrons back. And this is significant because pathogens, we know pro-oxidants are toxins, antioxidants, nutrients. Pathogens are your biggest pro-oxidant providers. You have endotoxins, exotoxins. Everything they metabolize is in an oxidized state. And of course, any molecule that's oxidized is electron-seeking. And if it's going to quench its loss of electrons, it's going to do it at the expense of oxidizing another biomolecule. So the interesting thing here is this means that, and in fact it's the case, I've seen it many times myself, Dr. Klenner has written at great length about it, and this was actually what got me into vitamin C some 20 years ago at Hal's office, is not only did I see patients feeling so much better and they were in wheelchairs, they had MS, they had Alzheimer's, they had Lou Gehrig's, and after 3 or 4 hours of extractions and everything else under the sun, they were perking up. I said, how is this possible? This type of stuff puts a college kid to bed for 2 weeks. And I said, okay, Hal, what's going on? And if you knew Hal, he put this tremendous ear-to-ear grin on his face. I called him Gator, incidentally. That was my nickname for him, you know. I don't know that he liked it, but I called him that anyway. And he pointed at the IV bag and said, okay, fine, Hal, they're getting an IV, big deal. I said, okay, it's what's in it that counts. I said, okay, what's in it? He said 50 grams of vitamin C. Well, that caught me completely off guard, but I couldn't deny what I was witnessing, and I said, it looks like I have to make my own evaluation and investigation of vitamin C. And that, if you will, began the odyssey. But bottom line is, as I started looking into it, it became very readily apparent that there was no poisoning, no intoxication that vitamin C would not directly neutralize. And for the longest time, I struggled with the idea that how can one simple little molecule, very close to looking like glucose, neutralize or negate the clinical toxicity of hundreds of thousands of toxins of different shape, different size, different chemical configuration, water-soluble, fat-soluble, large, small, etc. And the only logical conclusion was that all the toxins had to have a final common denominator of toxicity. And that, of course, is oxidizing or causing biomolecules to be oxidized. And vitamin C was especially good because it was a tiny molecule, like glucose. It could get everywhere in the body. Like glucose, it could use the glucose transporters, the GLUT1, the SVCT2 transporters to get into the cell instead of glucose. Also, vitamin C, in contrast to most other antioxidants, could contribute 2 electrons per molecule rather than 1, so that made it doubly potent. So all of these is why vitamin C is the prototypical antioxidant. It's also the reason why it will positively impact any toxin. I say any toxin, so far, everyone I know of that's been studied. If there's one out there that can kill you without oxidizing your tissues, I don't know about it. Okay. And logically then, I alluded to this, what determines what disease you have is how long has the increased oxidative stress been present? Where is it located? Extracellular, intracellular, different organs, different tissues. How concentrated is it? Minimal to severe. Is it combined with increased oxidative stress in other locations? And then finally, the nature of the toxin indicates where the oxidative damage is. I mean, even though all toxins cause their toxicity via oxidation, how can it be that one toxin can kill you in 30 seconds and another toxin takes 30 years to kill you, like cyanide versus mercury? Well, still, all they do is oxidize, but in the case, let's say, of cyanide, you inhale the cyanide, the unique chemical configuration of cyanide allows it to immediately go into the respiratory cells, selectively go into the mitochondria, and selectively poison the enzymes that facilitate the utilization of oxygen, and you basically die of oxygen starvation in a minute or two. Mercury does not take that pathway. It goes to different cells, different tissues, and then gradually builds up, and then 30 years down the road, you have MS, or you're suicidal, or any of a number of the things that are characterized with chronic mercury toxicity. So, Based on these concepts, then, what promotes chronic disease? Anything that promotes chronic disease is going to be a source of pro-oxidants or toxins. That's it. Number one, endogenous toxins. Of course, we're talking about dental here. Mostly, I say statistically speaking, most people's overwhelming source of toxicity contributing to causing and promoting their chronic degenerative diseases is going to come from pathogens from the gum, from the teeth with root canals and asymptomatically abscessed teeth, and that's what's in the book Hidden Epidemic. I'm not going to go into a big aside, but I need to say, especially in light of the end of the day lecture yesterday, we've got to get to the point, in my opinion, where the 3D cone beam examination is the integral part of any initial medical evaluation for anything, okay? Does somebody walk into the doctor's office and the doctor say, oh, wow, how long have you had a glucose of 350? We better get you on some insulin. No, they got to do the blood test. So how do you know that you have an asymptomatic, horribly chronically infected tooth giving you your heart disease, your cancer, giving you body-wide increased oxidative stress so that you're never going to get better if you don't look for it? Combine that, and the data is in the book, with the fact that depending on how you put together all the studies, somewhere, and to me this is still mind-numbing, but many of you have 3D machines now, so you know from your own experience the validity of what I'm going to say. It appears somewhere between 10 and 20% of all adult teeth around the world are chronically abscessed. Oh, okay. I thought you were going to argue with me. I was going to shoot you. And look, one tooth does you in. One tooth does you in, okay? Now, there are things, and I'm not going to have a chance to talk about it because this is going into a different direction, that allows you to cope with your infections better. Still, the best way to deal with an infection is to resolve it, which can't really be done currently with a chronically infected tooth once the pulp is involved, so it's extraction, okay? There are some circumstances where when you manipulate hormone function, especially thyroid, you can cohabit with your infections for a longer period of time. Because virtually all patients, and I use that term advisedly, well over 95%, all patients that have heart attacks have infected teeth. Root canals, gums, infected tonsils secondary to the root canals, but all people with those infections don't get heart attacks. So what is protecting one group from having the heart attacks? That's the big question, and I think the big answer is thyroid function. So, exogenous toxin exposures. The first thing is the endogenous are avoidable. We're talking about the ways to identify them and deal with them. Exogenous toxins, you don't have a great deal of control over contaminated air. You can impact the contamination of your food supply and water. Toxic iron status, completely avoidable. Okay, this is another thing. They put metallic iron filings in your food. This is probably the best reason for going organic or gluten-free. And many times when you go gluten-free, you also go iron-free, and your gut heals and you do fine. Gluten is just another protein. If you have an intact gut that's not leaky, you can digest it like you could digest any other protein. Just like kids that die from peanut allergies, if they didn't have a leaky gut from day one, ingesting this type of iron, they'd never gotten the peanut allergy to begin with. I mean, we have some folks close to my age in this room. I mean, how many of your friends in the 50s and the 60s were dying of peanut allergies when they had their peanut butter and jelly sandwich? None, okay? This is a man-made disease. by our insanely, incredibly stupid public health authorities. And they still haven't addressed it. Toxic calcium status. All I can say is the title of my book, Death by Calcium, is not an exaggeration. And I'll take it a step further just to make the point. The evidence is now pretty clear that you can classify calcium above the normal levels that you want in your body as a primary carcinogen, okay? The body manipulates calcium and iron and copper levels. Remember, the body needs to be able to kill cells just as readily as it's able to nurture cells. And unless it can manipulate its own natural intracellular ions, in this case, calcium, iron, and copper, it can't do that. Dietary toxin exposures, low sex hormone levels, and decreased intracellular thyroid function. Very big. Again, my time is limited, but reverse T3s need to be part of a standard profile along with regular T3 levels. Because you don't really give a damn what's going on inside the thyroid gland. And that's what the regular thyroid tests measure. You do give a damn of what's going on about the thyroid status inside every cell of your body. That's where the action is. All the stuff about the thyroid just confuses the issue. Just cut to the chase and see whether or not your cells have a minimal enough level of oxidative stress for the deiodinases to work correctly and make T3 versus reverse T3, the blank key, if you will, and keep that ratio at a healthy level and allow you to have normal thyroid function. Okay, Broda Barnes did it with temperatures and a few other things, but these days, these levels make it a lot easier and more elegant and easier to track when you take this approach. Now, okay, there we go. All right. And so these just follow what I just said. You prevent new toxins, neutralize existing, excrete pre-existing toxic stores. There's a lot of different things you can do to excrete toxins. Let me give you something that covers the bases 85% of the time without doing anything exotic or unnecessarily costly or difficult to track. It's two things: far infrared sauna and inositol hexaphosphate, IP6. And you take the IP6 on an empty stomach. Otherwise, it'll just bind stuff inside the food that you're eating and not go inside your body to take out the calcium, to take out the iron, and to take out the other toxic metallic ions that are usually a part of your chronically increased oxidative stress. And resolve infections, supplement optimally. We'll be talking about that in much greater detail. Hormone imbalance. Also, don't get carried away. I mean, believe me, modern medicine has very little to contribute. Very little, okay? For the most part, they actively impede and suppress the positive interventions that you could use with your patients. And for that reason, I think a lot of physicians should be incarcerated, okay? But let's just talk about the ones that just want to follow their own course and leave those who would want to do something else the hell alone, okay? So, don't overlook the fact that there are good prescription medications. Not a lot, but there are good ones. Individuals who think they're going to control elevated blood pressure by meditation and doing a bunch of things and taking homeopathy, all you're doing is inviting a stroke or a heart attack, okay? You need prescription medications. In my humble opinion, as a cardiologist, with all the other things that I've come to know, you need prescription medications to control your blood pressure. And if you don't control your blood pressure, you're laying yourself wide open. And some will meditate, and they'll get one normal blood pressure and say, oh, I got it controlled. No, 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 you don't. Okay, you got to control it 24/7. Okay? That's number one. The other thing, too, is antibiotics. All right? Utilize antibiotics. Vitamin C makes them better. It makes them more effective. And the last thing you want as a practicing dentist is to have the patient come back a week, 2 weeks later with an infected, pussing out area from an extraction, from whatever, okay? Antibiotics are not the boogeyman used in a short-term fashion along with the benefit of vitamin C, ozone, platelet-rich plasma, etc., okay? Now, yes, don't put anybody on antibiotics for months, okay? Something's not going right if you do that. But certainly make it part of the first 5 days, 7 days, 10 days, along with these other interventions, because vitamin C augments antibody production, okay? In addition to everything else, it augments the effect of things that have antibacterial action. They're synergistic. Also, many antibiotics work by unusual mechanisms, not the least of which is they chelate iron. Many of them. Iron feeds infection. So if you have something that you can take that's taking the iron out of the immediate environment, that's what allows not only viruses, but bacteria and other pathogens to proliferate. There's very few pathogens of any type that don't flourish when you give it a greater supply of iron. Okay, I'm going to fly through these just to show you the background of what vitamin C has done. It's killed and inactivated all viruses in vitro. Early on, Jungblut showed that the poliovirus could be completely inactivated by vitamin C to the point that after the inactivation, you could, poor monkeys, you could inject it into the monkey brain, and the monkey didn't get polio. And so we've seen these effects, and this is just a sampling. I don't want to just have a ton of slides with 55 things on each slide. This is just a sampling. Herpes virus, acute. Chronic is a different story. All viruses, chronic is a different story. Okay? It's a different type of infection than an acute viral infection. So don't confuse the two. Enteroviruses, influenza virus, rabies virus. Well, it would be malpracticable these days not to give the rabies virus when somebody's exposed to rabies. So we really don't have any trials where somebody has gotten treated just with vitamin C when they have rabies. Well, we have animal studies, and the vitamin C cures the animals of the rabies just fine. The early work of Klenner, mind-numbing. I got to confess, when I first saw this, I cried a little bit. I mean, come on. You've read your medical books, your dental books, your history of medicine. How many people have become crippled by polio? How many people have been killed by polio? How many people have had their life and subsequently the life of their families totally destroyed by this damn virus? What did Klenner do? Klenner, in the middle of a polio epidemic in Reidsville, North Carolina, in 1948, cured 60 out of 60 cases of polio, 57 in 3 days, and the other 3 in 2 more days, with injectable vitamin C. I'm not a big mathematician. I think 60 out of 60 is very close to 100%. Okay. Then he took a case of advanced polio. The little girl, 9, 10 years old, already had flaccid paralysis of her limbs. And for a more extended period of treatment, I think this was 2 weeks, she was able to recover completely and regain function completely of her legs. Okay, now this, I want to go back to what I said. When you have mainstream physicians that are willing to not only ignore this, but even worse, suppress it, and even worse, take away the licenses of physicians who use it, they deserve incarceration. I'm sorry, they deserve incarceration. Acute hepatitis, extremely effective. I didn't say chronic, extremely effective. And multiple researchers have shown this. Dr. Cathcart used a lot of oral, and you can do it quickly with IV, and you could do it almost as quickly with high dose enough oral. Here's some of the articles. Klenner also cured many cases of viral encephalitis where the patients presented in coma. Now, if this is something you've never encountered, I understand it, but let me tell you, when somebody who has viral encephalitis comes in coma, the healthiest ones are going to be dead in 2 days, and the less healthy ones are going to be dead in 1 day or a few hours. So, I mean, this is a viral disease advancing at its max. I had the unfortunate experience when I was a resident, and actually I was in Las Vegas of all places. Tulane had a program in Las Vegas, go figure. And a guy came into the emergency room, and I did everything, he looked fine. And I said, well, we're going to send your husband home. And the wife said, no, you can't send him home. So what are you talking about? I said, doctor, I've lived with this man for 40 years. He's not right. Not right. All the blood work looked fine. And she kept on insisting, doctor, he's not right. I know it. Well, I probably did a spinal tap with the flimsiest indication in the history of medicine. I did a spinal tap on this man because his wife said he was not right. And there was a minimal abnormality on it. A few extra cells in the CSF outside the range of normal. I still didn't want to admit him, but the wife was going crazy, and the spinal tap technically wasn't normal, so I said, okay, we'll put him in and watch him. Woof! Over a 18-hour period, he went into a progressive coma, seizures, and died. Viral encephalitis, if you could pull somebody out of it when they're in a coma, you got some serious heavy-duty medicine, let me tell you. Happened to another friend of mine, but I wasn't involved in his care. So, and all the easy ones, measles, mumps, acute herpes infections. Here's the animal article on rabies. And the modern-day terrors, gosh, there's just as much, there's more. There's more fake medical news than there is fake political news. How's that for you? And I couldn't be more serious. I mean, in the movies, Hollywood, you know, they have virus, they have outbreak, and ultimately every one of them ends with the happy ending that somebody found a vaccination. So, what about Ebola? What about Ebola? You know what Ebola is? Just another virus. It's especially bad because it rips like fire through a population in Africa that hardly has 3 antioxidant molecules knocking around in the body at the same time. So any toxicity is going to overwhelm them in a second. Believe it or not, there's many people in the United States with anti-Ebola antibodies in their system because it was just another inconsequential encounter with an antigen, and they developed the antibodies. Dr. Robert Rowan, back in 2016, wanted to take his ozone therapy to knock out the Ebola virus and show that it could be done. And I got to tell you, even knowing what I know and Dr. Rowan knowing what he knows, It took a lot of bravery to still just jump into the middle of an epidemic zone and start treating people. I mean, we're confident about a lot of stuff until our own butt is on the line, okay? And maybe there's one detail you hadn't thought about that impacts the whole situation differently. Anyway, I wanted, obviously, very much this to be a success. And I can't tell you the degree that this conversation impacted the way Bob did this, but I said, Bob, you're going to go and give ozone to these patients, and I have no doubt you're going to nuke the virus in a second, it'll be gone. I said, but you're going to nuke the virus, there's going to be a ton of pro-oxidant viral debris released into the bloodstream, the Herxheimer-type reaction, and in a subset that has very little nutritional capacity, very little endogenous antioxidants, please consider adding some vitamin C to the protocol, because this will, in my opinion, assure the fact that the patient will survive even after you've cured the virus. Well, again, he did put several grams of vitamin C in the protocol. He treated 3 patients. They completely resolved. They used that nasty 4-letter word, cure, okay? And the other thing, too, and this I was saying about nutrition, you have to remember that all diseases, some more than others, but 100% of diseases are due to a state of increased oxidative stress in different tissues. What is increased oxidative stress going to do? It's going to consume your antioxidants, primarily your vitamin C. Ergo, all diseases are variable degrees of acute scurvy. And even if, for the sake of argument, you don't think or don't want to evaluate where you think vitamin C is fairly inconsequential in actually destroying a pathogen directly, it certainly makes sense to always give vitamin C when there's a documented deficiency of it present in your patients. And if they could ever start bothering to do acute plasma levels of vitamin C in this fashion, that's what you'll see. Anywhere from low to extremely low to almost absent levels of vitamin C in these acute and chronic disease processes. Now, chikungunya, big word, horrible disease. Interesting, too, because it's just another virus. But it's a virus that, well, Ebola will kill you, but chikungunya will just destroy your life. This will take teenagers and give them arthritis so bad they can't get out of bed. And they just prefer to poop in the bed, pee in the bed. The arthritis is so bad. And it will persist for months to years. This is a lot of stuff you don't hear about chikungunya, but believe me, it's a horrible, horrible infection. They had a big epidemic of it in Puerto Rico, and they also had a big epidemic of it in Cali, Colombia, where my wife is from. Well, Dr. Marcial Vega got a hold of me, and we had a chat, and he was already doing this. He just pulled me onto the paper, so it's nice of him to do that. But vitamin C, hydrogen peroxide, ozone, all resolve chikungunya, no problem. Matter of fact, in Colorado, my wife came back from a visit from Cali with a friend who works with us, and they both had residual chikungunya arthritis. Okay? Incidentally, you don't need a mosquito to spread this. You don't need a mosquito to spread any of these things. That's more BS. Maybe a mosquito can do it also, but I saw whole families in Colombia with chikungunya. There are no mosquitoes in sight, so it could spread by inhaling and touching, okay, by any other normal viral contagions. Now, I used two different things with my wife's friend. I used, now you're not supposed to do this. So I gave direct intravenous ozone, which is actually extremely safe. And the only reason, and I've talked to Dr. Schallenberger about this, that it's not endorsed by the American Ozone Association, or whatever they call themselves, is because you're going to have some jackass that's not going to pay any attention at all to protocol, or you're going to kill somebody. You know, if you could do something perfectly acceptably in 7, 8, 10 minutes, and you do it in 15 seconds, that's apples and oranges. And they've given millions and millions and millions of IV ozone direct infusions in Germany for eons. Anyway, I forgot what the dose was, not important. Halfway down with the syringe, my wife's friend, she's not sophisticated, good lady, smart lady, not sophisticated. Her eyes started getting wide, and she starts moving her hand like that. That's how quickly it worked. That's how quickly it eradicated it. Same thing I did with my wife, intravenous vitamin C, halfway down, her arthritis magically disappeared. Zika, same thing. No problema. In the literature, again, they seem to have a lot of these exotic viruses down in Puerto Rico. So, vitamin C has been proven to be an absolute direct viricide. Kill the virus, or inactivate the virus if you want to be a purist, since technically the virus isn't a living thing without a host. So, it's an absolute viricide, often bactericidal, almost always bacteriostatic, and always, this is the biggie, strongly supportive of a strong immune system. It's my opinion, I like to differentiate between facts I gleaned from the literature and the opinion that I have based on those facts. It's my opinion that the primary role of the immune system is to deliver vitamin C where it's been acutely depleted. The monocytes, which are the first cell to show up at the site of inflammation, inflammation being an acute increase in oxidative stress and acute consumption of vitamin C, the monocyte has 80-fold, 8,000% more vitamin C inside it than the plasma. And everything the immune system does to repair is to neutralize oxidation and promote reduction. So just a little hypothesis for some thought there. Documented efficacy of non-viral, malaria, leprosy, dysentery, trypanosomes, syphilis, Chagas disease. Look at number 1 and number 3. Malaria and dysentery. How many people does that wipe out every year? If you just forgot everything else we've talked about and used vitamin C on all patients with malaria and all persons with dysentery, the impact you'd have on public health would be not even remotely matched by any agent, any substance, any medicine in the history of medicine. So, it's also the ultimate antitoxin. Neutralizes, look at that, mercury, lead, chromium, arsenic, cadmium, nickel, vanadium, aluminum, fluoride, also known as antitoxin. Venoms, alcohol. Well, now, I don't want to, they're recording this, so, okay. Mr. Policia, I'm not telling people to get drunk, but I will tell you vitamin C will neutralize alcohol, okay? And I'll give you even a little more dramatic example of that in a moment. Barbiturates. Toxic mushrooms. A Frenchman had a little cocktail of vitamin C, alpha-lipoic acid, and something else that reliably neutralized the toxicity of the Amanita phalloides toxic mushroom that just puts you into liver failure, liver necrosis, and kills you. Very, very vicious. Well, he got a lot of success with this, and again, he had so much success that he started giving lectures around France. And to demonstrate his point, he would take 3 times the fatal dose of mushrooms on the stage. Once again, I'm not going to be doing anything like that, but I'll just pass the information along for your clarification. Oh, maybe I'll take 1/10 the fatal dose and then get an IV with 150 grams. Pesticides, strychnine, tetanus. Now, the chronic infections, the biggies, Lyme, AIDS, chronic hepatitis. We've seen a lot of success on this, sometimes cure, oftentimes I like to call it a lifelong cohabitation asymptomatically with your infection. There are a lot of infections like that. They wall off, and one of the reasons they wall off is, remember what I said about thyroid? When your thyroid function is perfectly adjusted, you appear to have a tremendous resistance to the metastatic proliferative nature of a focal infection. They tend to stay put, okay? Now, Lyme, interestingly enough, wow, we got some, I had a extraordinary experience. I gave a lecture in Tennessee, I think, and it was mostly to a lay group at a hospital, and I talked about all this stuff. And I don't remember saying this, but I probably said, if you don't get the response with vitamin C that you want, you haven't used enough for a long enough period of time. So, this lady, having heard that, I later found out from the nurse that emailed me a couple months later, came back to the hospital, begged, pleaded, and finally they agreed to give her, I think, 100 grams of vitamin C intravenously a day, and she did it every day for 21 days. Now, here's the shocking part. After 21 days, she didn't feel better at all. But she wanted to continue, I guess, thinking about what I said. On day 22, and this is in the email, the nurse said it was like a light switch had been flipped, and she felt perfectly fine. And then, quite intelligently, she said, well, that's not good enough. We need to continue this for another week to make sure it's gone. And she was fine, and all her blood work resolved completely. And then a physician that I know took that ball and ran with it and claims he got a similar response in 14 other Lyme patients. So Lyme is a difficult nut to crack. One of the problems is the pathogen runs on manganese rather than iron. Nearly all pathogens run on iron as their redox metal, and for some reason, Lyme runs on manganese. And I'm assuming, perhaps, that lack of utilizing iron makes it that much more difficult for vitamin C to have the effect that it has. Tuberculosis, a lot of positive effect. Radiation toxicity. This is the work of Dr. Yanagisawa in Japan. The damage done by radiation toxicity is the same as the damage done by any toxin. It causes oxidation. The problem with radiation is it can knock out so many, oxidize so many biomolecules at once with a large enough dose, oftentimes you can't get enough antioxidant present to repair the damage before the individual dies. But when the scope of the radiation is a bit more limited, you get every bit the same positive response in repairing the damage done by the irradiation. So, you know, if we ever have any of these nuclear problems, I say forget the damn iodine and all that other stuff they're telling you about, but just get your lipospheric vitamin C, your intravenous vitamin C, every form of vitamin C you have, and max your dose out. Now, I'm not going to dwell on this. I'm going to just hit each one. The different documented ways that vitamin C has been shown to stimulate, support, and enhance immune system function. And remember my hypothesis that immune function, a bit of an older simplification, but immune function is primarily a way to deliver vitamin C where you have acute injury and acute inflammation, because it's the ultimate healing substance. Nothing else comes close. So vitamin C increases interferon, enhances phagocytes, concentrates in the cells, enhances the T lymphocyte immune response, cytokines, prolongs the lifespan, gives you more in number of T cells and B cells, enhances antibody production and complement activity. Now, I know I'm preaching to the choir here when we come across the subject of vaccinations, but I want to submit to you, and I had a conference in Australia 2 weeks ago, and of all things, I was talking to a group of pharmacists. Well, I said, if they're willing to listen to me, I'm willing to talk. But the interesting thing is, hey, they weren't really out there pushing their drugs as much as they were pushing supplements. And I went through a lot of the stores and the pharmacies in New Zealand with my friend who actually disseminates the lipospheric vitamin C out there. And I had made a few commercials in New Zealand, and they treated me like a rock star. I said, oh, you're the, I don't know if they use the word gringo, that's what I think. On the radio, yeah. Point being is, the vitamin C was the #1 over-the-counter product, not supplement, over-the-counter product that these pharmacies sold, okay? And every one of them had, you know, get your vaccination here. And I started thinking about it, and I said, we have to take a different approach, and this is what I want to submit to you. In Colorado Springs, about 10 years ago, we had a successful anti-fluoride water fluoridation initiative. Colorado Springs had already bought a couple $1 million worth of fluoridation equipment, so that sort of stacked the odds against us. But we went in, jumped anyway. And for the first few months, we just did we have the documented evidence that fluoride does this, and of course, they'd have the people that would deny it. And I said to my group, I said, we need to switch focus. And we started a campaign called Info. It's not fluoride only. So we no longer took the approach that fluoride is bad for you. Left that completely unaddressed. We said, if you're going to give fluoride, use pharmacologically pure fluoride. Don't be using the smokestack scrubber stuff with the arsenic and the lead and the mercury and everything else. And I don't know how much that did it, but that shut it down. Incidentally, New Zealand, I don't know if you know this, potentially in my opinion, one of the biggest health-related court decisions in the history of the planet. The Supreme Court of New Zealand ruled fluoride as mass medication. That's big. So I said, I need to take the same approach on vaccinations that I took on fluoride. I'm not going to bore you by telling you what I think about vaccinations. So what I told this group is I said, look, I've just showed you the evidence that vitamin C neutralizes toxins, And some very sensitive people, sensitive babies, sensitive old people getting the flu vaccine might react badly to some of the possibly toxic adjuvants that are in the vaccine. So vitamin C is there to neutralize that. And look what I just said. Vitamin C increases your antibody response to an antigen. What the hell is a vaccine anyway? So I said, nobody is going to say that vaccines are 100% effective at giving immunity 100% of the time. Might be 20, might be 50, might be 80, who knows? If you're going to give the vaccination, make it more effective. But of course, in the process, you're going to knock, I didn't say this. In the process, you're going to knock autism down to 0. And if it's not 0, it's as damn close to 0 as you could get. Okay? All autism, all these childhood disorders, I'm sorry, it's all vaccinations. It's all toxicity. It's all cumulative toxicity that the body can't deal with. Okay? And, I mean, well, I won't go too far into that. So anyway, I said, look, you can, over time, steal the vaccinations away the pediatricians because you're going to get better results and you're going to get possibly less negative results. So, enhanced natural killer cell, pathogen killing. Okay. So, I think I've set the stage where I can make my case that vitamin C, and antioxidants in general, but vitamin C as the prototype, is not only your ultimate therapy, it's your ultimate therapy for anything. Because everything is mediated by and worsened by increased oxidative stress. Starting to get tired of hearing that phrase, increased oxidative stress, but that is disease. So, vitamin C enhances immune function, has direct antipathogen properties, neutralizes toxins, repairs oxidized biomolecules, restores the lost vitamin C so that scurvy is no longer present. And I like number 6. I'll just read it for you. The electrons provided by vitamin C are the primary fuel on which every cell in the body runs. What I get emailed and talked about at conferences in my emails more than anything else is say, well, this is going on, or I've got this, or my patient gives this, how much vitamin C do I give? Well, then the lawyer comes out in me. Say, it depends. But I think you can see that everybody's oxidative stress load is different. Furthermore, we're in this mindset that you just can't take as much of something as you want because there's toxicity. No, there's toxicity with drugs. There's not toxicity with the primary fuel on which your cells run. That's like saying you can only have 1 portion of organic food. 2 is too much. Okay? So that's the freedom that you have with vitamin C. You can actually overdose and die reliably and predictably by drinking too much water. Can't do that with vitamin C. There has been no defined level of vitamin C above which there is toxicity, period. You drink 3 gallons of water in 15 minutes, you're going to die. I think that means water's a toxin. I mean, death is a pretty bad toxic side effect, wouldn't you say? So the goal, you want to get as much reduced vitamin C inside the cells and inside the subcellular organelles as possible. And you want to reach optimal concentrations and maintain them. Maintain them. That's the important part. All right. I have to I got 25 minutes, is that right? Okay, all right. I must humbly retract something I've been saying for years. Now, while I've never done any harm by giving anybody 25, 50, 100, 150 grams of vitamin C, I am now realizing, and I'll show you the evidence for it, that there are factors more important than absolute dose in terms of the impact of the vitamin C. And it has to do with frequency. Okay? So now, let's go down to number 4. What's the most important part of real estate? Location, 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 right? What's the most important part of French cooking? Butter, butter, and butter. What's the most important part of vitamin C now? Frequency, frequency, frequency. We have very powerful evidence to show that it's far more important to spike small doses of vitamin C throughout the day than the absolute amount you've given. You give 50 grams all at once, it's like this and out. You give 1 gram, 1 gram, 1 gram every 30, 40 minutes, every 2 hours, every 3 hours. Not only is it clear you're going to get better effect, remember that all biology is pulsatile in nature. It's not static. It's not a direct pressure. Look at your blood, your heart. There's your blood pressure. Everything at the cellular level. You don't have things that just press. You have things that pulse. It's a basic biological principle, and I strongly feel that applies very dynamically to any positive clinical intervention. Okay. Vitamin C and sepsis. The genie is now out of the bottle. I wouldn't have said this 5 years ago, but I'm going to tell you right now in a bold and arrogant statement, we're going to win. They screwed up. I must pat myself on the back a little bit and say I predicted some 10 years ago that we needed a situation where a mainstream practitioner who was the biggest man or woman at a hospital and nobody could question his or her authority, when that person decides, based on his or her own research, that maybe vitamin C could be useful, starts using it, and the result, this is important, is so fantastic that the nursing staff is blown away and they immediately call in the cameras. It's all over. And that's what happened. Dr. Paul Marek in Virginia is an ICU specialist, and he treats septic shock, amongst other things. Now, first let me tell you, septic shock is the #1 cause of death in a hospital around the world today. The final cause of death is septic shock, high percentage of the time. He found by giving, now look at this, 1.5 grams every 6 hours. That's 6 grams total, plus cortisone and thiamine. The thiamine is irrelevant, forget about it, but the cortisone and the vitamin C are important. Well, he found, well, first, it's very dramatic. He did this for the first time. He had a young lady in septic shock. He thought she was going to die. And I guess he'd been churning on this in his brain, so he told the nurses, go ahead and give this. And he went home that night, and he expected her to be dead the next morning. Instead, she was up eating breakfast, no tube in her throat. Now, mind you, the maximum amount of vitamin C she could have received in those 12 hours was 3 grams and 100 milligrams of hydrocortisone. So he knew he was onto something here. He did that in 54 consecutive patients, okay? And this is even misleading right here. 47, not 54. 4 of the 47 died, but of eventually their own disease. So it's just a strict end mortality type thing. These are a lot of sick people anyway. But 100% of them came out of their septic shock and was discharged from the ICU. 100% on 6 grams of vitamin C a day. You're talking about something where the patients are on vasopressors to sustain a blood pressure. They don't even have enough body strength to generate a blood pressure. These are people with, well, they got one finger and one toe keeping them out of the coffin. Now, this is interesting, okay, and I'll tell you why in a moment, but in Iran, of all places, I got nothing against Iran, per se, but it's not the place where I expect groundbreaking research to come out. Be that as it may, credit where credit's due, these researchers largely reproduced the same thing, but they did it just with vitamin C, and they got the same result. Now, the reason why vitamin C facilitates hydrocortisone effect by restoring the oxidized glucocorticoid receptors. What is present in advanced sepsis? Advanced body-wide oxidative stress. What does oxidative stress do? It neutralizes biomolecules. What is a glucocorticoid receptor? It's a biomolecule, and in the case of advanced sepsis, it's oxidized. So it's not working, and it's not binding the cortisol like it should. And because of that, before the patient dies, normally patients that are very sick have low cortisol levels. In the case of sepsis, they try to make more and more cortisol to overcome this, so paradoxically, the septic patient has high endogenous cortisol levels. So you don't really need to give the cortisone. All you need to do is give the vitamin C, reduce the oxidized glucocorticoid receptors, the hydrocortisone kicks in, and you get a massive anti-stress relief, and they come out of shock almost instantaneously. Also, flip that around, corticosteroids, and Dr. Honeyhackey and I have reproduced this at the Reardon Clinic in a little pilot study showing that corticosteroids, well, it's dramatically, I was going to say massively increase intracellular vitamin C uptake, okay? So that's about as synergistic as you could get. Combine that with the fact that vitamin C and hydrocortisone are arguably the 2 most powerful anti-inflammatory agents occurring naturally. They're literally designed by nature to work together. Now, drum roll, please. I like that. There was a study a long time ago, I couldn't track it down, but they wanted to induce scurvy in 6 volunteers. So they took all the vitamin C as best they could out of the diet. Several months later, they found 4 of these individuals were no longer spilling vitamin C in their urine, and 2 were spilling a potload. So what did they do? Well, they were interested in studying scurvy, so they cut those 2 people out of the study. It didn't occur to them that 33% of their study field was making their own vitamin C. So first point is, vitamin C deficiency in the human being is from the lack of transcription, proper transcription of the galactose oxidase enzyme, the 4th one in the liver. It's not due to a genetic programming defect. The program is fine, the transcription is bad, and it doesn't occur because of genetic disease, it occurs because of epigenetic disease, meaning all the factors that result in whether or not you produce a functioning protein from an RNA sequence. But think about this. You know, you had these limeys, they'd go out for 6 months. They always had some survivors. How's that possible? Okay? There's a lot of people out there that make some vitamin C, and some of them make a lot. That's why you got Grandpa smoking cigars when he's 100 and eating whatever he wants and pissing everybody else off that's trying to diet and do things right. So, a number of that. And I guarantee you, I wasn't there, so maybe there's a limit to my guarantee, but I guarantee you that these survivors didn't have stashes of lemons and oranges or anything like that. They were eating the same garbage, the salt pork, biscuits, pork, that everybody else was having. I thought this was interesting. The typical sailor's diet also included a great deal of beer. So at least there was some consolation as you were gradually croaking from scurvy. So, some very interesting factoids. I like that word. It's alliterate, right? Factoid. The loss of the ability to make vitamin C via the fourth enzyme develops shortly after the baby is born. But it's present in utero, and fetuses have vitamin C levels 4 to 11 times higher than the adult. That shocking to anybody? Okay. Furthermore, and this is interesting, a good benefit of breastfeeding, breastfed agents were able to maintain their vitamin C levels, after birth obviously, as much as 2-fold higher than their mothers, and equal to or higher than vitamin C supplemented control babies. This, I don't know where the Bantus are, Africa, New Zealand, Australia, I'm not sure, but they appeared, and these are children now, so we're well past birth. These children appeared to have the ability to remain free of scurvy in spite of only ingesting an average of 3 to 8 milligrams of vitamin C daily to go along with their severe malnutrition. And this is another study similar to that one about the 6 people that went on deficiency. Bottom line is, there's a lot of people out there that make vitamin C. It's not this irreversible genetic disease, okay? And it makes sense at another level. What's our problem with everything today? Toxins. So you get enough of the wrong type of toxins, you're going to mess up any biochemical mechanism the body has. And the proper transcription of vitamin C is one of them. Some of these people that make vitamin C, they probably have a unique diet. I'm going to tell you, this is probably, and I'll show you in a moment, the benefit of the Mediterranean diet, because that's where the nutrient polyphenol that I'm going to talk about comes into play. A few more So, now, stop codons. Let's see, let me go ahead here. Okay. Basically, you take your DNA and you pull it apart and you got 2 strands of RNA. And now those RNA serve as a template for you to step by step synthesize amino acids with a ribosome to make a protein. And you have codons, which are 3 nucleotide sequences that are used, they bind the chain and they start the transcription, and then a stop codon binds the end of it so that it has a beginning and an end. I mean, you can't just keep transcribing indefinitely. And that's very basically how transcription proceeds. However, every now and then, and it's not just with vitamin C, you have another stop codon that comes in and binds the middle of it. I liken it to a piece of gum on a zipper. Okay? It starts, hits the stop codon, no protein, end of story. But you have, for lack of a better word, and believe me, the genetics literature is more filled with meaningless large words than any literature I've ever gone through. I mean, they do not want anybody to understand their field, I guarantee you. Otherwise, their livelihood is threatened, okay? So they write in about as most obscure fashion possible, and that's saying something, because there's a lot of obscure writers out there. You know, when the title of a paper is longer than the abstract, that's what you're dealing with. Well, the garbage term they use, but it's effective, is that there exist agents that allows read-through over these stop codons. Now, what is the read-through? Does it mean the stop codon gets dissolved, gets bound? Who knows what? But the observation is this agent allows the transcription to basically skip over or read through this codon, and you get the whole protein. In addition, there's some other things that we're now seeing that puts all this together. We're seeing actual ways, genetic engineering, believe it or not, there's some horribly toxic prescription drugs, including including the aminoglycosides, genomycin, amikacin, that in some genetic diseases allows this read-through to take place, and you get, at the risk of great toxicity, a partial amelioration of that genetic disease, and nutrient supplementation. So genetic engineering, look at that. They injected the gene into fertilized fish eggs, produced an offspring that had enzyme activity. Point being is that's not anything we want to do right now because we have something much easier to do, much less expensive, and so far it appears to be much more effective. They have this CRISPR technology. I won't even try to read that for you, but in addition to everything else, it often inserts new gene mutations. So that's not a direction we want to go, at least at this point in time. If at some point in time they develop it with greater precision, then maybe they can suppress the nutrient and then charge you $10,000 for a CRISPR treatment. Okay, that's aminoglycoside. This is interesting too. Cystic fibrosis mutations are being read through with agents such as ivacaftor and Essen, an herbal agent. Also, resveratrol and thalassemia. Thalassemia is a point mutation, okay? And you can't make hemoglobin effectively, and so they get transfusions the rest of their lives. We now have clear evidence that resveratrol, which is another nutrient polyphenol closely related to the one that's pertinent here on vitamin C, takes 52% of thalassemia patients and makes them transfusion-free. So, pretty good stuff. Now, here's the gold standard study, okay? I got to confess, two things. I'm deeply upset that I didn't discover this myself. Okay. We're shocked. But I'm forever indebted to my friend for introducing me to this concept and showing me again, once again, how the most incredible stuff is buried in plain, open view in the literature. So they were interested in looking at the active agent in olive leaf extract in high concentration. Actually, they purified it out of it, and there's your article. And They just were doing a general profile of the effects that this had on blood work. Well, lo and behold, they did 3 blood tests, baseline, 1 month, 2 month. 14 out of 14, taking 45 milligrams a day. At 1 month, the vitamin C level had doubled, and at 2 months, it had stayed doubled. There's not really many conclusions I think you can reach other than the fact that read-through is taking place. However, anecdotally speaking, I started taking it, and I was hoping that it would turn me into a goat, which means I make 10 or 15 grams a day and release it into the blood. And if I'm unfortunate enough to have a big oxidative challenge virus, I'll make a whole lot more. Had no idea that it was going to happen. Long story short, the flu. 3 months ago, I got knocked between the eyes. It came on in like about a half an hour, muscle aches, muscle pains. I said, son of a gun, I got to travel, I got to move. I can't possibly be getting the flu. And I got depressed, okay? Anyway, this was at about 10 o'clock in the morning, went home, went to bed, woke up 11 hours later, and I was 85% well. The next morning, I was 95% well. The next morning, I was 105%, and my hypothesis is when your oxidative stress gets above a certain level, the liver, just like in the goat, kicks in and starts making vitamin C, and it's not going to make the perfect amount of vitamin C, it's going to overshoot. So for that third morning, I had overshot, and I had a sense of super well-being. Same thing, similar thing happened with my wife, and she had, it was funny. I had her on it for a few months, and she felt bad one night. I said, well, get a good night's sleep, dear. Next morning, God is my witness. Is there a Bible here anywhere? She looked like death warm over. She had laryngitis. She could barely talk. She couldn't smile. I mean, she was about as sick could be. And I said to myself, damn, it's not working for her. Okay. I said, I'll go get some chicken soup at Wild Oats. 2 hours later, somebody came in and occupied her body. She was smiling, she was in good spirits, and she could speak, no more laryngitis, and her eyes were like saucers. She couldn't believe what was happening to her. And then she followed the same pattern as me, 95% next day, 105% the day after that. Now, that's as purely anecdotal as you could get, okay? We do hope to have, and there'll be simple studies, be on this substance, and what happens when you normally have an oxidative stress and can't make vitamin C, your urine levels go down, your blood levels go down, you use it up, you go into scurvy. So what should happen if this is doing what we think it's going to do? You get sick, you start to get better, and the urine and the blood levels of vitamin C should go up. So that's the plan. We do know I've had 2 blood levels. They're both normal, okay, after being on this for 5 or 6 months. And I have my anecdotal evidence. So, let's see. And this to me augments all other forms of vitamin C. Okay, it gives you a steady state level, relatively steady state. We're also doing some things at the Reardon Clinic where we have bladders that are designed to give you a small amount of vitamin C around the clock. And I think this is going to have unique benefits as well, something that Dr. Klinner suggested many years ago. And, okay, so I want to wrap up by modifying my multi-C protocol. Oral liposome, sodium ascorbate to bowel tolerance, ascorbyl palmate for fat-soluble access, intermittent IV, but I think, and we've done a lot of IV pushes, myself and Dr. Reardon at the clinic and myself on my own, saves IV fluids, saves equipment, and I think now you're getting a better effect. I've given myself IV pushes with 50 grams of hydrocortisone, 12 grams of vitamin C, 4 or 5 units of insulin, and about a quarter of a gram of magnesium. IV push, 2 or 3 minutes, okay? And what does the insulin and what does the hydrocortisone do? It maximizes the intercellular uptake. A lot of stories there, no time for all of them. So I would end up by saying, in the words of Mark Twain, whenever you find yourself on the side of the majority, it's time to pause and reflect. And finally, even better, it ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. Thank you. In addition to the books, there's now a link on my website. We're just starting the production. It should be available soon, and that'll put you on a list if that's what you're interested in.